So, to everyone who joined, thank you, thank you, thank you. It's Friday. A lot of people are thinking about the weekend, especially during all the changes in our society. So it's always nice when we come together as a group. And as the summer is in full swing and all of us are thinking about the fall, and with the most recent changes, not just in society, but really specifically within sports, and how it impacts each and every one of us, I thought it'd be a really good time to let everyone understand like why, how, and what we're doing with Innovate AT. With any company, you grow, you evolve, and there's misconceptions and there's misunderstandings out there. And I really want to give everyone the opportunity to understand.
What a jerk. Oh, okay.
There we go. Sorry. So this is about what Innovate AT is, where it's going, and how it impacts you. And it really dives into that title. How can you revolutionize athlete care for the future? Because that really is starting to dive into what we're doing. And for the athletic trainers and the individuals that are on this call, that if you haven't talked to me, I have to kind of dive into my story, which is like the purpose and the why behind what we're doing. So for some of you that might not be aware, I worked with the US ski team for a little bit. So after grad school, I got a job with the US ski team. And like a lot of us, we reached the pinnacle, and I kind of joke, I had the best office view, right? These are from Italy and Austria and Switzerland. And I realized that that wasn't for me. And it doesn't mean that it wasn't right for anyone else. I was just seeking more. I wanted to have a little bit more of control over my life. I didn't want to be at the beck and call of a team and not seeing my family or doing what I wanted to do. So what I did was I really started to contemplate, what is it that I want, right? And I was in my mid-20s, normal age, right after grad school, you get your first job. And I knew that there was just something else I wanted. And through some of the discoveries that we've been offering through Innovate a Team, I finally realized that my personal why is to find a better way, and then I want to share it. So when I was doing this, I said, there's got to be a better way. I didn't know what it was. I didn't know how it was. So what I did was I left the clinical side of athletic training, but I worked in other businesses. And the reason that's important is by working in other businesses, I started to learn about other industries. And I started to learn other business models. And I really started to realize there's a better way for athletic trainers to grow and evolve as a professional. And I say that very distinctly. I'm not trying to change the profession of athletic training. So part of this conversation today is let everyone understand we're doing something that's very different. I'm not saying athletic training is good or bad. I'm looking at the individual. And there's a better way for all of us to accomplish what we want to as an individual. And while I was in other industries, I still had my foot in the profession because I'm the treasurer of our district. I'm part of D7. And I started to hear a lot of the same issues all over the country, all different levels. And if you look at this picture, a lot of it is on the left. We're undervalued, no one respects us, I want to make more money, no one wants to pay us more money, we're overworked, my work life is all messed up. And when we started the free Facebook page, it was really just to get a pulse on the profession. Is what we're hearing the truth? And we just started with a free Facebook page. It was like, hey, let's take action. Let's figure out what is out there, what people are saying. And what really started to morph into the data was the individuals who were seeking more, who wanted more from themselves and from their own personal career. When they started to question an old way or think of new innovative ways, they started to become the outcast. They were the black sheep. And that's why they felt isolated. They kept on trying to do certain things and kept on hitting a brick wall. And when they have these ideas, no one is listening. And that is the dividing point of our profession. And that's where people either stick it out or they leave. That's why people go to PA school, they become a PT, maybe they become a doctor, they go into medical sales. All of us have friends who have reached that tipping point, or maybe some of us have already reached that tipping point, and that's why they're part of Innovate AT, because they reached that point of now what? What am I going to do? And this is from a ton of customer discoveries. This is not just Adam's opinion. I've been talking to athletic trainers for 5 years, and this is the common theme of they get to this point of now what do I do? So really, so all of you guys know what we're doing is we're helping the athletic trainer, the individual who is struggling to make a greater impact. They want to make more money and they're struggling with this work-life balance. Our main focus, everything we're doing with Innovate AT is around a community. And it's a community of the right type of thinking. The individual who is thinking in the future, how can we make things better? I want to support my colleagues and I want to empower one another because we understand what self-worth is. And we want to help each other reach the highest potential because we all have the capability of making the desired income if we are in the driver's seat. A lot of you have heard me say independence versus dependence. And because of the latest situation with sports, that is extremely evident that our profession has put the athletic trainer dependent on the sport instead of in the driver's seat of their own future. And we're just looking at it from a different value standpoint because the diagram on the left, we're in a very, very unique position between sports and medicine. And all of us on the phone, we know it. So if we go to, well, how are we doing it? We're challenging the status quo. We're not doing the same thing over and over. We're trying new ways. What are we doing? We're innovating. And to bring true innovation, because of the time we're in, technology is part of it. And that's the quote from Ron Kind. Technology is driving the innovation. Without technology, we're just doing the same thing over and over and over. And we're utilizing technology in a way that hasn't been utilized in our profession before. So Innovate AT is a health tech company. We are combining technology and a community to provide better care for athletes. We're leveraging technology and you. And I think that's where athletic training gets lost is we don't leverage the individual. We're always focused on what other people think about us. We're focused on the treatment. We're not leveraging the athletic trainer themselves. So our vision is, yes, we want to support athletic training, but how do we put the athletic trainer in the middle of a platform to create the platform for athlete care, right? And how do we revolutionize athlete care? We have a very, very big vision of what we're trying to do with Innovate AT. There's 3 things that every athletic trainer I talk to is focused on. They want to have vertical change. Vertical change is a much greater opportunity for impact than just a lateral. I go from a high school to high school. I go from a college to a college. I want to impact a lot of people. I want to make more money. And what are we doing? We're creating a solution that makes sense. We're not just talking about it. We're not just hoping for it. We're doing it. So if those 3 things resonate with you, then you're in the right place. There's 2 opportunities to be within Innovate AT and how we're going to revolutionize athlete care. The first one is the community partnership. There's a bunch of tools that we provide, and it's really focused on how do we elevate each other. We all have expertise and we all have value. And if we talk about some of the pain points in our profession, We don't make enough money, yet we constantly ask each other to give everything away for free, and we won't pay for anything. So we're kind of flipping the paradigm that if you're an athletic trainer that's been experienced and you have a document, you have an Excel sheet, you have a presentation that you think brings value to another athletic trainer, ignoring the CEU requirement. It is just something that an athletic trainer can use immediately and gain value. We look at, well, let's have our community start to increase their personal revenue. We're going to work with companies and there's a store within it so we can save money and start to build income because we're selling products to people that are always asking for our advice and we keep on giving it away for free. So these are just some snapshots of the internal resources that we're building, but it's all centered around the community and how each one of us can support one another. So the resource hub that you see on the right is really just, hey, here's a document. And it ranges from, some of it is free. If you're just part of it, you get to use these resources, and this is how you go get standing orders from a doctor. This is an example letter that you can show a physician to talk to them. It ranges from everything. And the community has so many resources. How do we build it together? The next wave is really where we're taking innovation and building an opportunity for you that doesn't really exist right now. This is where the health tech piece comes in. And this is where the independent business piece comes in. And I read this article on the bottom left when I was just putting this quick little presentation together. Athletic training is a forgotten community. We all know that. We're underutilized, we're underserved. And the next wave of innovation will be when these forgotten communities stand up and say, we have a resource that is valuable. And the premise of that article was technology is going to replace the human element. Well, with what we're doing, we're not just using technology. We're using the knowledge, the experience, the relationships of each one of you to bring a service to millions of amateur and recreational athletes that doesn't exist right now, who are all seeking that type of guidance. And the only way to do that is that top quote on the left really highlights it. Every once in a while, a new technology, an old problem, and a big idea turn into innovation. And that literally is the space that we're in right now. And it all stems from, there's a difference between self-worth and value. Value is how someone else perceives you. Self-worth is how much am I worth? And we all know that athletic training is the most underutilized, undervalued service in healthcare. Every single one on the phone is going to agree with that. But we've always been dependent on someone else understanding our value. And what we're creating with Innovate AT is, you are the most valuable piece. Let's give you the independence. And for some of you that have jobs in colleges and clinics and high schools, I'm not promoting or recommending or suggesting quitting your job. That's not at all what I'm saying. There's a mental shift from I'm in a dependent position to an independent position, and we're putting opportunities in place to accelerate from dependent to independent. But I'm not asking anyone to quit or we're only focused on private business. We are focused on, though, a very unique aspect of the profession, which is centered around accessibility. And the coverage model and the care model, they've been there forever. And if we talk about innovation, our profession is the rotary phone. And some people might disagree with me and some people might get offended, but the rotary phone was from the 70s. And other providers are using a cell phone and they're texting people and they're using FaceTime and they're sending emails. And the profession of athletic training is literally looking for a wall to plug their phone in to use it. If athletic training doesn't evolve and use technology, it's in serious problems. And one of the things that we focus on within Innovate AT is the most overlooked service, which is the accessibility to the healthcare system that athletic trainers provide. This will make sense to a lot of you. If you've worked in a school, if you've worked in a college, if you've been on a pro team, you have built trust with your athletes. And over time, they ask you questions. Hey, My son or daughter hurt themselves. What should we do? Do we need to go to the urgent care for this? Can I get a referral to your provider? And guess what? We're all doing it for free, and we're the product of our own misery. This is the opportunity, guys. We're creating a whole new opportunity for all of us to go to the next level as an individual. If the profession follows, fantastic. I can't impact the profession of athletic training, but I can have an impact on an individual that wants to take the leap and work with us. So some of you might be listening. It's like, well, I'm kind of interested. Like, well, what does this really mean for me? With any startup, with any company, you have to do market analysis. You have to know who your target is. And this was even updated this week because we're constantly looking at how are we providing value to the individual. One of these 4 categories, these 4 avatars might fit you. And if it is, we'd love to talk when it's over. If you are an athletic trainer that is curious about new ideas, you're just always questioning like, well, what about this idea? Yeah, I'm not really into the same old, same old. How about this idea, right? We are right for you. If you think that there's a better way, we are definitely right for you. Well, what if we tried this way? That way just doesn't work. I have a better idea, right? That is my why. That's why I built this whole thing. If you have faced challenges in the profession, we are right for you. And once again, challenges don't mean you run from them. It doesn't mean you don't want to participate in them. It just means I face challenges, but I want to come up with solutions. We're right for you. And if you are seeking opportunities that make sense to you, then we're right for you. If someone is like, nope, the old way is the only way that I know, I can't budge, I'm stuck in the mud, cool, that's totally fine. We are not right for you. So if anyone on the call, if you're starting a business, knowing what you are and what you aren't is just as equally important. This is really important. And this is what separates us from other groups or from the NATA, which I'm still part of the D7, and why we're different. We're focused on the professional, and all the other groups are focused on the profession. In the NATA in our districts and our states, they're focused on elevating the waters for the credential. They're focused on advocacy. They're focused on networking, and then they're focused on the bare minimum CEU requirement, which is great. That's what they have to do. They're like any other professional association in all industries within the country. But we are really, really focused on this community feel. And it's around engagement. And that's where we have these calls. We're starting virtual happy hours. We have calls with people one-on-one, and then they start to really work with each other. And then it's the personal attention. And what we have experienced because of COVID, a lot of people didn't have a plan B. And they're just stuck. They're furloughed. They were laid off. And they're waiting for sports to come back, hoping sports come back. And there's no guarantee sports are coming back. Just yesterday in New Mexico, no high school football, no soccer. And then today, the governor is saying, we don't want college athletics in New Mexico in the fall. Like, it's not going to change for a while. But the profession has made us dependent on sports, and no one has a plan B. And that's why we're creating this personal attention, that we're focusing on the individual. It's not my plan B. I don't really care what you guys do. I just want you to be successful. We just want to give you the tools and the opportunity to have conversations to create that path for you. And the most important thing, and this is what I've learned along the whole time that I've been doing Innovate AT, and this really separates the people that truly understand and truly support us and are truly active, is enjoy the journey. I don't have the answers. This is not easy. You have to work for it. If somebody wants it easy, if someone expects it right away, this is not the group for them. You have to adapt to what's going on. And we talk about relevant topics. And because of COVID, there is a journey, but it's all centered around personal growth. That if there is an individual that says, hey, I'm for it, I don't expect it to be easy, and I want to work for it because then I'm going to appreciate it more, that's the personal growth. And if we all look at our education, and if we look at the first day of Athletic Training 101 class to where we are today, in that first day of class, every teacher across the country talks about this is the profession for the next 40 years. So that path was laid out for us. Everyone knows that. That was the traditional model. Because we're kind of veering off of that very smooth freeway and creating a new path in the woods, we all have to be acceptable of changes and pivots, not just for like Innovate AT, the company, but for your own life. If there's not a path written and you have to create it, you have to accept the journey that's going to come along the way. Just to give you a couple quotes, just while people are on the phone, before we start to let people that are on the call that might have some feedback about the community and how it's helped them. These are just some quotes that you can read real quickly. We are really putting these summits together to continue this type of thinking and this type of camaraderie and the type of support and empowerment. We have companies that are supporting this. I talk to companies every single day that know athletic trainers are the most underutilized aspect in sports and in medicine. We just got off the phone with an amazing company that really loves what we're doing. They see you as an individual as an opportunity for growth. And these speakers have all taken this leap and have all taken this step in their own personal direction, and they just want to support a new way of thinking. And if you're looking for just new ideas, this summit is a great way to do it. Great way. So I'm going to open it up. I'm going to take everybody off mute, and I see people that are on here. So I'm going to ask some of them if they have any feedback or if anyone has questions. I just have to get there. So unmute all. I see people's pictures, and I'll probably ask people, but if anyone has anything that they want to ask or say at the beginning, it's free forum, free forum. Megan, I think you might be off mute. So do you have any thoughts?
I mean, I really like the concept because, I mean, we obviously are a very underutilized profession, and I think that came to light during the pandemic as a lot of people get furloughed or laid off. And I think my question would be is how are we going to help bridge that gap there to help cater to that athletic trainer like you mentioned?
So, great question. It's not easy.
Yeah.
And if we talk about technology, there are ways through technology and through marketing and through SEO that you can have a consistent message across the country, so then the end user, right, the customer understands what we do. And if we look at some of the problems that face athletic training, no one knows what we do. They think we're trainers, you know, all of those conditions exist. But if we ask two athletic trainers in the same town what they do, they're going to have two different answers. Mm-hmm. So we can't expect the customer or the end user to understand what we do if we don't say what we do consistently. So when we talk about technology and we talk about that Wave On product, we are including economies of scale. We're including constant and consistent marketing. So across the country, every athletic trainer that's within our system will be communicating their service in the same fashion. So that's one way we can do it. I'm looking at the list. I'm gonna see who's on here. Does anyone else have any questions? I see Todd. Todd, give some examples of what you have kind of learned and thought since you have now been part of Innovate AT. Just so the non-Innovate tiers, the non-community partners can get a sense of how it's helped you personally.
Yeah, I mean, the thing that we talk about this on our calls all the time is just I think you kind of referred to it as being the black sheep earlier, and I'm sure everybody on the call can relate to that. Just having a space to be able to bounce ideas off people, especially with other people who have outside of the box ideas. That's one of my favorite parts. You really talk about the community feel, and that's one of the coolest parts about that. And I think, and once we have that, plus all the with the resource hub and the dashboard and the stuff on the website, it's only going to grow, as people put resources up there and we can learn from each other and have webinars and whatnot. But I just enjoy talking to people about their ideas and, my ideas and what feedback they have for me and feedback I have for them. And just the community feels the biggest thing that I love, because again, when I try to talk to somebody who isn't on the same wavelength, they look at me like I'm a little bit crazy, and I kind of get tired of, feeling like that. So it's nice to have kind of a quote unquote safe space to talk to people who I know, they're not gonna think I'm crazy. They're gonna give me either constructive criticism or constructive feedback where I can build off that, and then I can do the same for them. So.
No, that's perfect. I see Tyler's on. Tyler, do you have any thoughts around speaking your truth in our space, in our safe space, and other people accepting it instead of feeling like the outcast?
Yeah, can you hear me? I'm on the phone.
Yep.
Okay. Yeah, I think it's kind of built up. I came in late on this call, so I'm not exactly sure it's covered to start. But to answer your question, I think it's just, I know kind of what Todd said, talking to other colleagues. I mean, I'm a young athletic trainer. Having new and different ideas sometimes is frowned upon, or kind of just like pushed down. And coming to Innovate, it's been nice to have the opposite, I would say, like finding mentors that are willing to push you, have the uncomfortable conversations sometimes that we need as we're going into new and different things. And getting away from is one thing that's happened to me, is getting away from like the little brother syndrome that athletic training has. We need to do what other people are doing. And it's okay to embrace our differences and to say, like, this is what we are, this is what we do, and other athletic trainers aren't doing this, and that's okay. So I think that's the mind shift I've had differently. It's okay to embrace the differences we have. We don't need to be like the other professions. And if we're doing different things as athletic trainers than the masses, that's okay. We'll be there to help them when they want help.
No, that's great. I'm going down the list and I see Kelsey's video. So I'm just going to ask you, Kelsey, do you have any questions or thoughts? Did anything resonate with you? Do you have, I'll say something that you didn't appreciate that you want to discuss, because everything is open. We really want to help people understand what we're doing. So all feedback.
Yeah, no, I definitely appreciate everything that you and everybody's doing at Innovate AT. And I know me specifically, I'm pretty new out within last 2 years. And initially I started my business to be that bridge of, I was in the fitness world, saw a bunch of movement issues that led to all of the rehabs. And I saw these two worlds completely separate. And now being in that world and trying to figure out how do we get both worlds to combine, I'll tell you, there is a need out there for it. And I love to have this community to be able to progress that.
No, that's great. Yeah, we should definitely continue to talk more. After the summit, we're going to be doing more calls like this. So we just have to get through one activity at a time. I'm going to let Scott talk, and hopefully you're able to hear, because Scott and Kevin are both looking at it from a data standpoint, because I know both Kevin and Scott are on the call. Do you guys have any feedback from how athletic training can go to the next level once we have appropriate data, and how we're working on that?
So, and that's a really good question. And you bring up value, and you bring up worth, and that's basically where I focus on. I look at the economical aspects of what our profession is capable of, and we're not nearly taking advantage of what we need to do. If you have a collegiate setting, and this is local where I'm at, that wants an athletic trainer with a master's degree, wants an athletic trainer working, 60 hours a week for a 10-month contract, and they're going to pay them $35,000 a year, that is just a ridiculous laugh in the face. So when I talk about looking at it in an economic perspective, some of the projects that I've worked on, the personal research that I do in my company, AT Efficiency, have discovered that not only are we are valuable on the economic side, but our value is actually will actually help us increase our worth. All right. So when I say that is, I've talked to a healthcare economist, Dr. Lee, out of Oregon State University, and he's done really good research focusing on the economic impact of athletic trainers and looking at other allied healthcare professionals. And he has looked at us and said that we are the number one healthcare providers that are able to save money with healthcare versus basically contributing it to a bunch of different.
Janine Greco is the name. Greco.
A bunch of different.
7/27/19.
So when we look at a bunch of different in that perspective, we are able to basically save money. So when we look at data, that's basically what I'm collecting, and Innovate AT is basically the ones that are accepting of this and able to provide that educational aspect of it.
And one thing I want to highlight, I am part of the NATA. I am our district director. We are not trying to do what the NATA does. There's no reason to duplicate efforts. We need to have the NATA for promotion with state practice acts, right? We have to have it for licensure. We have to have it. We're focusing on the professional. So if Scott has a unique way of looking at it and bringing value, and if there's just so much bureaucracy and red tape or time with the NATA, that's where Scott feels that we might just have a little bit faster runway to implement some of his ideas. And when we talk about our community partners can contribute to this, it's then looking at other athletic trainers that also want to contribute to it as well. So that's why I wanted kind of Scott to just mention what he's working on, because it really goes into that resource hub and presentations that we're going to be putting on to really bring value to everybody.
Yeah, and I apologize. I had a runaway baby. I lost my train of thought. But anyway, so yeah, absolutely. When we look at the economic aspect, when we look at data collection, we look at ways that we can really enhance what we're doing as a profession. Because, like Adam said, we are the rotary phone. When I talk to people about data and data collection, and Kevin will be able to speak on this as well, because he has a little bit more background and experience with that. But when we try to talk to people about, hey, this is what you can do to collect more information, this is how you can document. I mean, I did a study and we released a survey to athletic trainers, and they said that the least valuable attributes of their profession are rapport with the community and documentation. In order for us to thrive and to continue to progress as a profession, we need to be able to have that rapport with our constituents, which is our patients, and we need to be able to have good documentation. And when I mean documentation, I mean good data collection. And we refuse to want to do that because we don't get paid like other professions to have good documentations for reimbursement, but that's just not necessarily the case. So, there's tons of opportunity here. Like going back to the healthcare economist, we're able to collect this information, right? And we have a lot of it. We have a lot of exposures. There's different ways we can collect that. There's different avenues. So these are some of the projects that I work on. And what I've seen, there's a ton of opportunity here for us, a ton.
And it goes into, we listen to our community partners, right? We listen to the community, and we're trying to build this opportunity that if someone has an idea, yeah, let's run with it. Let's see if we can make it happen. Is it going to be easy? Maybe, maybe not, but we can try to turn it into something. I'm just going to continue to go down the list. Joseph Rose, I don't know if we have talked. I'm trying to unmute you. Maybe I can. There we go. Unmute. It's not working. Joseph, can you hear me? Can anyone hear me?
Yes. Can you hear me?
Yeah. Who's that?
Janine.
Yeah, Janine, give us your thoughts from the presentation, just what other people are talking about. All that kind of stuff.
Yeah, this is my first call, and I'm actually really excited about it because I've been working at the high school level for longer than I like to admit, and I got furloughed. I just got back on the 15th of June when we start back. I'm in Florida, so hopefully no one here knows who I am actually, but basically I've brought up a lot of these. I've lived in 4 different states. I've worked several places, and I brought up a lot of, I guess, innovative ideas. And I actually got written up the first day I came back because they don't like what I have to say. And I've never been written up from a job in my life. And so it's just like, it's time to go, so I'm at a cross point, looking at different things and stuff like that. So I have some things in the making, but this is kind of like a really, really cool call just because I've had ideas like this for a while. I've had different ideas, and I totally agree with everything that's been said.
No, awesome. Yeah, I mean, the screen you see obviously has the website. You can go join as an official community partner, but you can also contact me. I love talking to athletic trainers. I mean, everything I have constructed and built is from these type of conversations and the customer discoveries. So I love hearing what people want, and then we start to build it out. Kevin has a question. He has his hand raised. I'll let him dive into what he wants to mention.
Yeah, no. Sorry, you called me out. I was just gonna tack on to Scott's feedback. I mean, just on the area of data and technology, that's one area I'm excited to kind of expand inside of Innovate AT and the community partners, just to start to have those discussions. I mean, most of my career was at Division I level out in the West Coast, and I've seen some historically administrative positions that we held as athletic trainers that are now being given to sports scientists and data people that, because they are literate with data. And that's probably that's one of my main passions, is to to improve the data literacy within athletic training, because that's a springboard for us in healthcare, and some of the work we've done at the Pac-12 level, kind of is a reflection of that, but really focusing on the quality of data that we're getting, because we're inundated by data sources, and being able to leverage technology to help us with that huge conundrum is what I'm focused on. So just to tack on to what Scott said, I mean, this whole concept of data analytics and data science is one area within Innovate AT that we're going to be looking to expand upon and start those discussions.
Well, to give
Adam.
Kevin credit, Kevin is presenting next week at the virtual NATA conference, and we're supporting them as much as we can. But Kevin's presentation is really on the data collection within sports tech, and athletic trainers are literally just giving away this information. We're just like, okay, someone else take it, and everyone else is capitalizing on it. And that kind of goes into that model of we're the rotary phone. Like, from a business standpoint, we are not evolving. And until we realize that our real asset is data and relationships, nothing's going to change. It doesn't matter how many people like us. If we don't have data behind it, we're not known anymore. So his presentation next week, if you're going to be part of the virtual conference for the NATA, definitely look it up. Joseph, I was trying to ask you before. I don't know if you're able to unmute now. You are. Just want to hear your thoughts. Brian, same with you. If you have any thoughts. No. Does anyone else want to say anything? Sarah Huppy?
Hey, yeah, I did have a question.
Yep.
With the summit that's coming up, I just want to put in a plug for the last summit was awesome. One of the best conferences I've ever attended. I felt like I really learned from people that were so excited about sharing what, like their experiences as well as what they're good at, what they're passionate about. So that was really awesome. And I wanted to ask Adam, is this one going to be recorded? So like if you can't watch it live, can we watch it later?
Yes. 99% yes, unless there's a glitch.
So,
but right now, it's going to be recorded. Yes.
Okay. So if
Yep.
I sign up, then like that, I should just register regularly and then be able to watch it later. Is the plan.
Yeah, you could do that. Yeah.
Okay.
Yeah.
Then I will sign up. Perfect.
Perfect. Anne Marie, any questions?
Adam, I just have a comment. Oh, go ahead.
Well, I was just gonna revert back to within the partnership concept with the sharing of ideas and different things in that kind of format. Is it resource tools and documents, or is it that plus like just collaborative effort and trying to construct things?
Great question. We have 3 main focuses that we are addressing when we are in the content of Innovate AT. Personal development, business concepts, and then clinical or revenue producing clinical topics. So an athletic trainer might have had 30 years of experience and they have the most amazing shoulder evaluation and treatment protocol, but they've never been able to do anything with it. All right, well, let's figure out how to get your content on the website, and then other athletic trainers can learn from you. Maybe there's CEUs, maybe there isn't. It's not about going and creating a whole certification. Sometimes athletic trainers just want to share that information, and they don't want to do a research paper. They don't want to do the EBP route. They just want other people to know it. So that's kind of a combination of everything. And or it's just, no, I want to be part of this initiative. Okay, well, let's figure out what that initiative is, and we'll try to create the resources available so then we're able to do certain things. And it's always going to be dependent on what like the athletic trainer wants. We might have ideas, but if there's certain things that athletic trainers are passionate about, yeah, let's figure out how to do it. Some of it will be now, some of it might be in the future. It's all based around resources, but we can definitely do some cool things. Anyone else have any
Adam,
questions?
Go ahead, sorry. I just have it's Nora. I just have a comment that maybe will help with people with those types of questions. I don't know if you remember, Adam, but I do. 3 years ago, we first talked, and I remember it specifically because I was coming back from Europe, and I was trying to vie for Wi-Fi anywhere to talk to you because I was so happy that I found somebody that was like-minded in myself. And I remember what you said. You said that you're talking to a lot of athletic trainers, and they're all doing something different. We're all trying to innovate in different ways and change our lives in different ways, which is great, but that won't get us anywhere. We have to do it together. We have to have a clear, concise message that is simple, it's consistent, and we stick to a plan. And to me, that's what Innovate AT is. We have a roadmap, and that's our roadmap, is that we can't do it alone. We all have to do it together. And just the fine details aren't together, but that's the point of a roadmap, is you follow it. You don't trace it and get to an end point. So if that helps kind of clear up some questions or what Innovate AT means to me, it all comes down to that very first conversation that we had, and that resonated
with me the most, and I turned around and was a community partner. I think, that whenever I was able to get back into the States and have Wi-Fi.
No, that's good. I kind of remember that now that you bring it up. And I think a lot of the people that I've talked to, I think that is a similar conversation I've had with them, because we've been talking about that in the last couple of weeks. I mean, I want to stress to everyone that is new or kind of dipping their toe in this Innovate AT thing, I don't have the answers. I just know that there's an opportunity for all of us to do something together. And I have open arms, like, hey, who wants to be part of this movement? Because it literally is a movement. Because unfortunately, if we don't change, athletic training is going to die in 15 to 20 years. That's my personal opinion. Some people agree with me, some people don't. But if we don't evolve as a service and as a business behind the service, it's not going to go anywhere. And we can impact each other. We can empower each other. So that's the testament that the kind of the message has stayed the same since I talked with Nora when she was searching for a strong signal coming back. It's really good. Anyone else have any last minute thoughts? If not, I mean, this is it. Well, if you guys have questions, there's my email. Let's talk. Like I said, we'll be doing more of the summits coming up. I just really wanted to give a strong understanding of what Innovate AT is right now, where it's going, how it's evolving. So I appreciate you guys all being here. Thanks for your time on a Friday.
Thanks, Adam.
Yeah, thanks. Have a good weekend.
Thanks, Adam.
Yeah.
Thanks.
Have a good one.
Thank you.
Thank you. Appreciate it.
You're welcome.